All right. Good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Today I'm talking about Meniere's, and I'm redoing this broadcast because it didn't quite come out the way I wanted to. So here, this is a really important issue that I want to make sure everybody with Meniere's knows about. That sounds maybe a little grandiose, but nonetheless, I recently did a broadcast on Meniere's talking about associations with food allergies, autoimmunity, thyroid issues, and went through a lot of cool research articles. I'm kicking myself because I wish I would have had this article in there and I didn't. I came across this yesterday. It was actually published in 2017, and it very much proves the association between the foods that we eat and how the foods that we eat may be affecting something like Meniere's disease. So in this article out of the Journal of Otolaryngology, Head and Neck Surgery and Medicine, or something of that nature, 2017, as you can see right here, they looked at, I believe, around 26 Meniere's patients, 14 of which were symptomatic, meaning they were having vertigo at least twice a month, really bad spells of vertigo, as most of you know Meniere's involves hearing changes, tinnitus, ringing in the ears, pressure in the ear, typically a low-tone sensory neural hearing loss, and sudden onset vertigo that lasts for hours and is often associated with vomiting. It's miserable, as many of you know. And so they had symptomatic patients like that. They also had asymptomatic Meniere's patients, but they were all considered definitive. So there were no confounding variables, like they didn't think that they had vestibular migraines or some other condition mimicking Meniere's. And they compared them to, I believe, 20 healthy controls. And they looked at signs of gastrointestinal dysfunction in the form of what's called intestinal permeability or hyperpermeability, also known as leaky gut syndrome. Horrible term in that I don't like leaky gut syndrome as a term, but it is the common term being used in the scientific literature. So if you talk to your doctor and they say leaky gut syndrome doesn't exist, I would beg to differ, and I've done many broadcasts on that in the past. But here they're looking at leaky gut syndrome. This is basically an ear, nose, and throat journal connecting to Meniere's disease. So basically, those are the nuances of the test. They looked at the absorption of two carbohydrates, lactulose and mannitol, and these carbohydrates shouldn't absorb excessively through the GI lumen. And if you start to see these carbohydrates in the urine, that means they got through in an excessive fashion. That's one of the first tests used commonly for leaky gut syndrome. They also tested fecal calprotectin. Fecal calprotectin is a marker of intestinal inflammation, and that test is usually used for like ulcerative colitis and Crohn's disease. Here they were using it for Meniere's patients to see if they had signs of excessive inflammation. So, looking at the graphs, I know it may be hard to read, but this is the symptomatic Meniere's patients. Here are the asymptomatic Meniere's patients in the control group, and that same format is laid out for all of these graphs. This is looking at lactulose, mannitol, and then this is looking at the fecal calprotectin. What you can see is that the symptomatic Meniere's patients were higher in all of these values than everyone else, saying that they were absorbing these carbohydrates excessively through their gut, i.e. leaky gut syndrome. The interesting thing is that they were absorbing both carbohydrates irregularly, whereas in ulcerative colitis versus like celiac disease, the absorption of both is not typically seen to be excessive. Usually one will be higher than the other. So the authors talked about that Meniere's patients, it's like an open sieve, so to speak, in their GI tract, where they're absorbing a lot of these carbohydrates through, meaning that other proteins can come through the GI tract as well. Your intestinal epithelium is basically one cell layer thick, bound together by these proteins called tight junctions, and these tight junctions, think of them as a zipper. So the thought process is like the zipper opens up in leaky gut syndrome, which is being shown here for Meniere's patients who are symptomatic. And then also their markers of intestinal inflammation and this fecal calprotectin marker were very high. As you can see, for asymptomatic Meniere's patients, they were below about 50. Controls were much below 50. And some of the symptomatic Meniere's patients were up around 225, which is very high. I've run a lot of these tests, so you don't usually see them as being high. So this is a really important finding. So what does it mean for you? It means that if you have Meniere's disease, and you have allergies, or if you have eczema, or if you have vitiligo, or if you have a thyroid condition, or if you have Hashimoto's thyroiditis, which is where the immune system attacks the thyroid. Talk to your doctor about checking for that if you want. And or maybe you have gastrointestinal issues where you eat gluten and you don't feel as well. 57% of Meniere's patients have a positive gluten allergy. 57%. You may want to start thinking that Meniere's disease is due to opening of the gastrointestinal epithelium at a microscopic level, allowing excessive inflammation to be generated in the GI tract and throughout the body, and that is thought in some way to affect drainage of the fluid in the inner ear through the endolymphatic duct, as it's termed. So it's just like a little pipe that drains the inner ear. So if that pipe isn't draining because there's a lot of inflammation, then that can result in the pressure, ringing, and vertigo associated with Meniere's patients. And they talked about in this article that Meniere's patients have been found to have excessive GI lesions, actually. So they've found lesions in the GI tract of Meniere's patients. So this is really, really important stuff, and I hope you find it interesting. Check out the article yourself. Again, Dr. Randall Gates, board-certified chiropractic neurologist and chiropractic physician at Gates Brain Health. Give us a like, a subscribe. There's our contact info, and let us know if you have any questions. Thanks for watching, and have a day.